Hi, my name is Sarah Ula, and I have the privilege of serving as a program director for the Ophthalmology Residency at the University of Maryland. Our residency program is dedicated to training the next generation of compassionate, skilled, and innovative ophthalmologists. At the University of Maryland, our residents gain comprehensive exposure to a diverse patient population and a wide variety of ophthalmic conditions. With our partnership with several hospitals, including the University of Maryland Medical Center, the VA, and the University of Maryland Midtown campus, our residents experience hands-on learning with a high patient volume across a range of settings. Our curriculum is carefully structured to balance clinical experience, surgical training, and academic development. Each resident participates in a variety of didactic sessions, including grand rounds, subspecialty conferences, and hands-on wet lab, led by faculty who are dedicated educators. We also emphasize research and encourage our residents to pursue their individual interests within ophthalmology, whether it be basic science, clinical trials, or health policy. Our program is truly a close-knit community where faculty and residents support each other as colleagues and collaborators. We prioritize mentorship, wellness, and work-life balance, recognizing the demands of residency and supporting our trainings every step of the way.
Hi, I'm Kenny Taubman-Slag. I'm the Associate Program Director and one of the Retina faculty here. Welcome to University of Maryland. We hope you have a great interview day. We're excited to get to meet you, and we hope you get to learn a little bit more about our program.
Hi, I'm Waqas Munir. I'm the Associate Program Director and Chief of Ophthalmology at the VA.
I'm Lisa Shockett, and I'm Chair of the Department of Ophthalmology at University of Maryland School of Medicine. I'm super proud of our residents, faculty, and our program as a whole. My vision is for our department to care for our patients, teach our residents and students, and perform research in a friendly collegial environment. We achieve this goal every day. We have all the resources you need to become the best ophthalmologists. First, we have the VA on our main campus. Second, we have a robust resident practice on our Midtown campus. Third, there's experience in all subspecialties in our faculty practice. Next, there's the world-renowned shock trauma, where you see tons of ruptured globes and other trauma. There's plenty of surgical volume. There are a multitude of research opportunities, and there's plenty of experience with community engagement. In summary, I'm proud of the high-quality care we provide to our community while maintaining a collegial and supportive atmosphere amongst our residents and faculty. We are excited to share more about our program with you. Welcome.
Hi there, I'm Doug Brown, one of the senior ophthalmology residents at University of Maryland. I'm here in the resident workroom here at the VA. And I'm going to use this time to talk about kind of our curriculum setup, since a lot of med students tend to ask kind of what our rotation schedule is like. So now that we're combined, you'll be up at the Midtown Clinic, where you'll spend 3 months during your intern year in our busy resident clinic. And that's good exposure. A lot of the days will be retina, glaucoma subspecialty days, as well as general ophthalmology days. Then starting in your ophthalmology rotations, we do pediatrics, oculoplastics, general, retina, all throughout our first year. And so that gives you some good exposure to different clinics, different sites. And then you'll also be operating, kind of start extraocular, so on muscle surgeries on pediatrics and orbital surgeries during oculoplastics. And then as we rotate to our second year, we're doing also VA consult rotations. We're doing oculoplastics again and doing glaucoma. And you'll start doing cataract surgery in that year as well. So good exposure there, getting more operative experience, doing more of your lasers, doing more in-office procedures as well. And then our senior year here, we spend a lot of it at the VA. And we rotate through the different subspecialty clinics here. Today was a retina day. The day before we did cornea. And there's always generally an OR going on. So we'll do a high volume of our cases, our cataracts, corneal transplants, the rare K-Pro, retinal surgeries for detachments, as well as glaucoma tubes. And then we'll do strabismus cases here at the VA. And then we'll also do some oculoplastics occasionally throughout the month too. So a lot of good exposure, a lot of surgical exposure here. And that's kind of our how we set it up for residents. Sometimes you're at a different location, just doing kind of whatever subspecialty is coming in for that week. And sometimes you're with a different attending and you kind of move around with them throughout that rotation.
Welcome, guys. I'm going to take you into one of our exam rooms. Here we have two of our team members, Caroline and Rob. And you can see that Caroline's looking at Rob's eye now, and we have the camera here. This camera allows us to take a look at the anterior or the front of Rob's eye.
Otherwise, we've got everything else you need in this room. Come work at the computer, put the patient in the chair here for the slit lamp. We've got our indirect behind us, and a variety of tools like supplies for injections, things like that. So fully stocked exam rooms for all the work here in Midtown.
Here we are in the state-of-the-art laser room here at Midtown. All your laser needs. Here's our laser. This is where we do YAGs, SLTs, PRP in here. So really every type of laser you want to do, here's your room.
Hey again, guys, it's Jordan. Just wanted to welcome you to our cornea room here. We have our IOL machine and biometry. This is where we do all of that.
We got visual fields, OCT room right here, our fluorescein angiogram.
One of the last little tools here are Pyxis. We get a lot of medications for here, for like intravitreal injections, stuff like that. And then over here,
We have our resident workroom. The highlight here is definitely the windows. We got lots of natural light, a great view, makes for a great day at Midtown every day. Of course, we have our coffee station right over here, some delicious Nespresso. And Miss Debbie always makes sure we're nicely stocked with snacks.
The VA is an excellent place to learn, I think, for our residents as part of our surgical curriculum. The PGY3s actually start their cataract surgery in their third year of the program. And the VA is one of the primary places where they'll learn cataract surgery and do their first cases. As senior residents, the residents get to do the majority of the cataract surgery at the VA as well. And it's a great environment. The patients are super appreciative. Just a great population to work with. I think most of our residents really enjoy their time at the VA.
All right, welcome. We're going to go through our Baltimore VA here. So we're in kind of our imaging room that the technicians will get all of the imaging that you'll need. We've got here our Galilei for cornea patients, two different OCTs, Optos photos, which is fantastic, get really good wide field views, and FAs. We've got our B scan if anyone needs a B scan for anything. We have a couple different exam rooms, so all of the residents will work out of their own rooms here. And then down there is our kind of minor procedure room and laser room. That we have all of our retina lasers as well as our SLTs and YAGs. Here's a couple more ophthalmologist rooms, and then kind of down this hall and the other hall, we have our optometry colleagues also work out of this VA, which is a great relationship. So they'll see a lot of their patients, their general eye exams. They'll bring you in whenever they need you to see a patient, and then they'll also kind of refer a lot of their surgeries to us too. And so it's nice to have that collegial relationship together. Here's one of our exam rooms. So pretty typical. We've got our indirects, we've got our slit lamps. Here at the VA, every slit lamp has a teaching scope, which is very nice and beneficial. And then we have all of our computers that will pull up the different imaging for the patients.
Hey, this is Victoria, one of the PGY3s. I'm currently on my consult rotation. This is our consult room on the 10th floor of the main campus downtown hospital. We have some couches to relax on here and a great view of the city, including the Redwood Clinic across the street, as you can see here. We have a portable fundus camera to take pictures of different retinal or optic nerve findings on consults. We have a coffee machine here, and of course our consult bag with all of the supplies that we need to do exams and procedures on consults and on call. We have some string lights up and decorations thanks to Dr. Levin, and a printer here too. And here's our call room where you can do some work or take a nap while on call. This is a quick tour of the GBMC eye clinic that we come to as part of our pediatrics and oculoplastics rotations. It's a beautiful campus out in Towson, Maryland, and is roughly a 10-mile drive out of the city. Our PGY4 residents also take call here for the GBMC hospital on evenings and weekends. There's also the IC simulator here that we have access to 24/7 to learn the steps of cataract surgery.
When we're not at the VA, we like to do a lot of different things around town. So we have the Orioles and the Ravens sports teams here. So that's very exciting during the season, and then they tend to let you down after the season or towards the end. We're also pretty close to Philadelphia and DC. So if you like those sports teams, they're also very easy to travel to. I personally am an Eagles fan, so I always head down to FedEx Field to catch a game during the Eagles football season. Otherwise, there's always a different festival going on. There's a lot of different spring, summer, fall festivals to go to every weekend downtown. And in Fells Point, which is a nice neighborhood that a lot of us live in. And then there's also some Winter Village that will be starting up here towards the later end of November. There'll be a nice Christmas village in the Inner Harbor that people will tend to go to. There's an ice skating rink there. Otherwise, people generally get together. We watch movies, TVs. We were watching kind of Bachelors in Paradise. We always had a watch party. And then a lot of us do volo sports. It's kind of in different cities. So I myself, I'm on a kickball league. A couple people are on now pickleball that they play pretty frequently. There's also pickup soccer that some of the residents do and different things like that to stay active. Along the Inner Harbor, it's very nice. So I generally try to run around the Inner Harbor. Some of the residents bike. They bike to work. Some will kind of bike up and down there. And then there's also trails outside the city. A gorgeous trail is a little bit more north of the city, and that's closer to the Baltimore Art Museum, as well as the zoo, which is incredible and pretty cheap. So I tend to go to the zoo, see some animals, and there's also a bunch of different events there that's always nice to be put on. Other things we do, there's always fantastic restaurants that we eat at a lot. A lot of people like to go to Charleston. They like to go to Cingale, Tagliata, some nice Italian restaurants. Clavel is a really nice Mexican restaurant that we all like to go to. And then Ekiben is like a fast casual Asian fusion that we'll pick up from a lot. That's all really nice. So if you want to come visit here too and then check out the food scene, that's always good. And then that's what a lot of us do. A lot of people ask, where do we live? We all generally live in the Inner Harbor. Fells Point or Fed Hill are the two main spots. And then people kind of live outside the city too and kind of commute in. What's nice is it's a very easy drive and not too bad to get to work in different locations here.
Thank you for considering the University of Maryland's Ophthalmology Residency program. We're excited to share more with you and look forward to helping you find the best fit for your future career in ophthalmology.
Now recording audio. Well, nice.
In halls of learning, skills I find. No cataract can mess my mind.
This is the old B scan. I thought that table might be useful.
Sleepless nights and the city lights.
Hey everyone, so this is our minor procedure room here in Midtown. We've got this patient here. She's ready for like a full facelift / laser excision / craniotomy, major procedure here. As you can see behind us, we've got all sorts of tools that you need. Some of the tools we'll use across the street for consults. We've got the B-scan behind you, so this is a kind of a do-it-all room here for us at the day.
Eyes wide open, see them shine. Skills in motion, all defined. Want more, I'm here to stay. Cataracts won't stand in my way. Microscope and steady hands. Vision clear where shadows land. From dark to light, I guide the way. Sight restored by break of day. Wrapped in tight with with beats alive. Baltimore's where dreams survive. Learning, cutting, stitching time. Mastery in every line. Eyes wide open, see them shine. Skills in motion, all refined. Baltimore, I'm here to stay. Cataracts won't stand in my way. Eyes wide open, see them shine. Skills in motion, all refined. Baltimore, I'm here to stay. Cataracts won't stand in my way. Eyes wide open, see them shine. Skills in motion, all refined. Baltimore, I'm here to stay. Cataracts won't stand in my way.